Hey everybody, welcome back. And today we're back talking about ankle pain. This is our second part of our series. It's called the Pain Series. And I am Dr. Kevin.
I'm Coach Sean.
We're the FitHealth Pros.
It's true.
It is true. Now, last series, the part one of ankle pain, we talked about structure. We talked about swollen ankle issues and then other common injuries. Many common injuries, really.
There's a lot. There's a lot.
So,
that's why we have part two.
Absolutely. So building upon that, what we wanted to do is today we're going to focus on, again, some more injuries. We're also going to tell you about the specialist that you may see and what to do there. And then we'll get into some injury prevention. So since there's still a lot more to go, let's go ahead and get right into it.
All right, we're jumping right into injuries continued, ... First thing I'm going to talk about today is flat feet. Now, flat feet are when you have no arch between the heel and the ball of the foot. Now, this could come about by way of injury, by wear and tear. I actually had a client who had a genetic predisposition for it, and that can also be common. Now, the big thing when it comes to the ankle and causing pain in the ankle is that when the ankle gets out of line with the knee, you're putting a lot of pressure on both the knee and the ankle, and that's where you'll get some pain, you'll get some swelling. They may prescribe arch support or special shoes or inserts for your shoes. They may actually send you for some physical therapy as well, just to see how to remedy that line from the knee to the ankle. Next thing I want to talk about, now the thing with this video is we're going to talk about some kind of heavy duty stuff, some very painful things. Next up I'm going to talk about lupus. Now lupus is an autoimmune disease where you actually get fluid buildup within the joint. Now it could be the ankle, it could be other joints, but we're talking about ankles today. With a healthy diet, with regular exercise, you can stave off some of these flare-ups of lupus. There is no cure, so once you have it, you have it. You can take medication to control it, but then again, with a healthy diet, with regular exercise, you can take these flare-ups down quite a bit. I actually have a client with lupus that we're able to stabilize quite a bit just through consistent exercise and watching her diet. Next up, another one that's pretty intense is gout. Now with gout, you oftentimes equate that with the big toe. You know, that's rich foods and the big toe inflammation. It's so painful. Now this is when uric acid turns into needle-shaped crystals within the inflamed area. Now this causes intense pain, swelling, and you can imagine needle-shaped crystals jabbing into that soft tissue, very uncomfortable. Through rest, medication, there is a specific gout diet that you can utilize. Again, rich foods can trigger it. If you have a specific diet, that can take that down quite a bit, the number of flare-ups that you get per year. And regular exercise. You know, you want to have that blood flow throughout the body. That can also help. The last one I'm going to talk about right now is called scleroderma. Now this is a group of conditions in which skin and connective tissue thickens. So you can just imagine that ankle joint where the connective tissue just starts thickening, and there'll be pain, there'll be stiffness. It'll actually weaken muscles because the tissue itself is thickening. Now it can also cause digestive issues, heart issues, kidney issues. Again, unfortunately there's no cure for scleroderma, but the issues can be treated individually, especially the issues related to the organs.
Wow, okay.
Oh,
Now,
man.
yeah, here's some more complications. Now these, you know, some of them are more rare, I would say.
Sure.
But it is amazing how many things go along inside the ankle itself. So we want everyone to be aware, and sometimes it's not just for you if you have it, but if you have a loved one or a family member that has that, just kind of knowing these things and
This will give you some research to, we're just giving information. Hopefully we're helping with every video.
right. So let's go into a few more of these things. So chronic lateral ankle pain, that can be something that may present itself as an irritation to the side of the leg or the side of the ankle. And you just don't know what it is. But here's what we found. We found that obviously the lateral is the outside. I mentioned that. So there's a ligament that's along there, and that's weakened after a sprain. Now, if you have joints that are not very stable, there's a possibility, and a very good possibility, that you're going to have more injury, that you're going to have more pain.
Sprains beget sprains.
Right, it's going to reoccur over and over. So you definitely have to be aware, why is this happening? So that's why they call it chronic. It's something that's happened many times over time. So look at resting the area, making sure that you're not putting any undue stress on the area. And then you do have to have exercises to strengthen those support structures. So there's a balance there between resting. We don't want to say be off your feet completely, but you want to make sure that you're strengthening areas. I would probably say that you're looking at the quads and the calf, some of the muscles of the feet, maybe even doing support exercises all the way up to the glutes in the back as well. All right, so here's another one. Osteochondral lesions of the talus. Now in the last video we kind of described the talus for you. That's going to be in the back side of the foot. So there's bones, including the heel bone, the calcaneus there, that's going to make that up. So you're going to have damaged cartilage within the heel structure. It could be fractures, blisters, or even sores. So this one's not a good one.
None of these are good in this video.
Right. You may feel a catch in the ankle. It's going to lock up. Pain months after the injury. The treatments could be casting, crutches, physical therapy. All right. So the last one of the complications is called reactive arthritis. Another arthritis. We talked about two different arthritises in the last one. Again, inflammatory process within the joints, the arthro. Now, this one's different. It's going to follow infection of the GI or urinary tract. Now that one kind of, it's like, well, how would you know, right?
Right.
So
you wouldn't be able to guess this on your own.
Exactly. So that's where the history comes in. So you can ask yourself, if you're having ankle pain, have I had a recent GI or urinary tract infection? So that's probably the best thing to do. And if you don't know, then obviously go to your primary care doctor or specialist. This one, because it's an infection, they have antibiotics for the infection. You may be prescribed anti-inflammatories for the pain and the swelling. And then you're going to get exercises for flexibility. And that should go away. It's going to take a few months though. So the quicker you identify that, the better, because you want to rule out the many other things that we talked about in these last two videos.
Right.
All right, so that's that. And we'll go into the specialist. We want to go into that.
So speaking of specialists,
Yes.
and there are many that are highly qualified for ankles and feet especially. Orthopedists, orthopedic surgeons, physical therapists, other rehabilitative specialists that are hyper focused on the ankle complex itself. Now, what these specialists are going to look at? They're going to look for poor ankle mobility with a lack of flexibility in the muscles of the calf, the back of the lower leg there. They're going to ask about prior injuries and surgeries. They're going to look for possible nerve complications, the nerves that are passing through the ankles. They're going to look for torn or inflamed tendons, inflammation of the joint lining itself, scar tissue after a sprain. You know, that's something that might need to get cleaned up a little bit. But basically, they're going to do a verbal history with you. They're going to give you a physical examination, maybe a palpation exam. maybe x-rays, maybe bone scans, CT scans, MRIs, depending on what's going on, if it's ligament related, if it's bone related, if there's a possible fracture. Now, if it does get to the point where you may need surgery, these are some of the surgeries they may perform. They may be removing loose fragments within that ankle. They may be cleaning the joint surface with such things as bone spurs, things like that, smoothing things out. They could be repairing or reconstructing ligaments. So if you sprain your ankle enough times, maybe that ligament doesn't come back with its flexibility and it needs to be dealt with. Also, same basic thing there with tendons. They could be transferring tendons from other parts of the body too. It's pretty heavy duty. I have a lot of respect for ankle specialists because there's a lot going on within that ankle. And as we saw with part 1 and part 2, there's a lot of things that can go wrong.
Right.
You know, and they have to really know their stuff to diagnose correctly.
Right. And then I just wanted to throw in, during that physical exam, don't be hesitant about telling the doctor about previous traumas, previous injuries. Yeah. A lot of my patients will think, well, this injury that I have right now, that has nothing to do with my my back, or it has nothing to do with that accident that I had when I was in college. All of those things are you know, they go together, so it works together. And then the other thing I wanted to say, don't be afraid to get adjusted. Of course, if you have a tear or a sprain, there's certain manual adjustments that we can't do on there because the tissue is not stable. But there are instrument adjusting and then manual adjusting that can reset the ankle and all its bones. Mm-hmm. And when I say that, it doesn't take a lot just to get off a little bit. And I see it all the time. It's very common. People who don't run very well or have issues when they can't stand on their feet for very long periods, a simple kind of distraction type of adjustment, because there's so many proprioceptive nerve endings around the ankle, sure, that helps address a lot of balance and proprioceptive issues, and it does reset that, and that can basically bring that strength back to the whole entire area, to the bottom of the foot, the ankle, the knee, and the hip, just from the ankle adjustment. So I thought I'd throw that in there too.
Oh, wow. Thanks.
Yeah, you bet. So the fourth thing, the last thing is injury prevention. Getting the adjustment. I guess that's part of it.
That's part of prevention right there, yeah.
So there was a very large cross-sport study, and it found that the most sprains by far, 40%, were basketball players. So yeah, you can imagine, you know, within, you know, the confines of the court with the, you know, jumping in close quarters and all of that kind of stuff. So what do we want to do? Well, we find that with prevention, warming up is probably one of the most important things to do. Making sure that those ligaments and the tendons and muscles are warmed up properly. Taping and bracing is very important. We found that 1/3 less injury when you have bracing.
Yeah, which is interesting, yeah, because you see a lot of taping, but you don't see that much bracing.
Right. Yeah. So I would say that it really depends on the sport, and then also maybe how big the person is as well.
Sure.
How much power,
momentum,
is going through
power.
There. Yeah.
Yeah.
Because there is that trade-off between, when you have taping and bracing, between actual locking that joint out and still providing flexibility. I'm thinking of like gymnasts when they're running, and yeah, they want to have that full range of motion, but they're taped up pretty well.
True.
You know? So balance, I like this one a lot. I think Sean does too. This is huge because, again, a lot of proprioceptive nerves reside in the ankle, and so having an exercise that works on balance and coordination, like a tilt board, Bosa ball, all of those things, and if you have reoccurring injuries, that's going to be a nice way to kind of introduce an exercise component, a strengthening component there.
So that's something that I do with all of my clients, from 5, 6 years old all the way up into their 90s. can't overemphasize how important it is to get that balance, you know, way before possible falls can happen and before injuries happen.
Right. So if you came here just looking for ankle information, you're getting a little bonus here. Because,
It's true.
I mean, I think we both agree, you know, so many people think of crunches, planks, and the core strength as being important. But man, if you can balance in that standing functional position and have those muscles kind of start firing,
Yeah.
that's, I don't know if it's
Goes
bigger.
all throughout
I mean,
the nervous system.
Yeah.
You know, you think of the nervous system itself, you're firing all throughout your body, trying to maintain balance. And it helps everything. It helps your overall athleticism. It helps your general balance. And again, like we're talking here, injury prevention.
Right.
You know, the ankle and other parts of the body.
I almost want to just leave it with that. But there's one little tidbit. It's an interesting one. Kind of going back to basketball and some other sports like hiking and things where you see high tops involved or a higher boot. Guess what? Most studies show that the high top for preventing ankle injuries, it's inconclusive that it helped at all. But you do want to wear proper shoes for the activity. So you're looking at the stabilization of the foot, whether it's flexibility, the lightness of the shoe, how it bends, how it grips and tracks, I think is going to be important.
Yeah. And again, we're talking about force, we're talking about momentum. If your body's going one way or the force is heavy cutting, you got to have proper shoes for that kind of a heavy cut, like on a basketball court.
Yeah, and I think, you know, my son's ankles are like mine. They're kind of weak and susceptible to injury, but we found that a mid-height basketball shoe or a low with a brace around the ankle on the inside, that did a lot more
Than the high top.
Than the high top.
Yeah.
Yeah, so, you know, whether it's a tape, and nowadays, I don't know if we mentioned it in the last one, but I'll mention it again, the technology on the bracing is so much better.
It's so much better. It's more breathable. You have a little bit more range of motion for the unaffected areas. You know, oftentimes the old brace would lock the whole complex down. Well, you don't necessarily need to do all that. You still need that blood flow coming through to help the healing of the injured area too.
Yeah, and if you can wear something that's not taking you out of the game, you can wear a shoe still with it.
Even better.
It's even better. So that way you're preventing that injury, you're still maintaining your sport and getting better and better. So, hey, there's positive there.
Look at that! Look at that! This was such a heavy-duty downer in terms of the type of ankle pain and maladies, and we come back and we give you a little button at the end there.
There you go.
All right, so thanks so much for being with us on this journey. You know, hopefully you've watched 1, 2, 3, many of our videos at this point. We keep putting content out there to educate, to help, to kind of give you more information. You know, a whole lot of information given here that you may not want to go through study after study after study to find out. Well, we're giving it to you in these videos. So hopefully you liked this one.
Smash that like button.
Smash the like button. Smash the subscribe button. Ring the bell to be alerted of when our next video comes out. You'll get an email letting you know that, hey, FitHealth Pros are here and we got something else for you that can hopefully help you.
Absolutely.
So today, pain series, ankle pain part 2. We focused on less common ankle injuries, specialists that focus and what they're looking at when they're poking and prodding you, and injury prevention. So thanks again for coming along for the ride. We are the FitHealth Pros. I am Coach Sean.
I'm Dr. Kevin.
And come along for more of the ride.
Right.
We got this journey is just starting.
Thanks so much for watching.
Thanks, Al.
About the ankle. Let's start over.
One take 2.
Take 2. Let's get these out of the way right up front. What are we?
We are the FitHealth Pros. Thank you for coming to watch.